So cerebral palsy is the most common physical disability of childhood, and it lasts a lifetime. It affects 1 in 500 Australians. And really, it's one of those conditions that unfortunately has lagged behind other childhood conditions in the research. It's really hard to know why, but it's possibly related to the use of the word cerebral palsy, which is an umbrella term, and it also has a lot of varying clinical pictures and varying severity. One of the reasons also that it's lagged behind other areas is that there's been an obsession with birth asphyxia as a cause of cerebral palsy. So we now have one of the very highest rates of cesarean section in the world, but that didn't really affect the rate of cerebral palsy. We've also excluded children who have birth defects, and they're a large proportion of people with cerebral palsy. There's also been a chronic underfunding of research. Now, this afflicts most childhood conditions, but cerebral palsy has been particularly underfunded. One of the other problems is that cerebral palsy has many co-occurring conditions or morbidities. So epilepsy, chronic pain, intellectual disability. And I'd like you to remember that 30% of children with cerebral palsy will have dislocated hips, and they'll have scoliosis of the spine. One of the good things, though, that we do have in the research arena is the Australian Cerebral Palsy Register. This register is the largest single country register of people who live with cerebral palsy. And we have data on over 7,000 Australians. One of the great things is that we have shown that the rate is beginning to drop. So it used to affect 1 in 400 Australians. It's now down to 1 in 500. And there's some really new data just out that it may in fact have dropped to 1 in 600, but that's very early results. We shouldn't overcall it. Another great thing that we've seen from the data is that those people who are living with cerebral palsy have less severe cerebral palsy. So they're more likely to walk, less likely to have epilepsy, and more likely to have normal intellect. The important thing for today to talk about diagnosis and early intervention is that we know from the register that cerebral palsy can be diagnosed quite late in many Australian children. So it's diagnosed after the age of 6 months in about 50% of children. So 1 in every 2 children with cerebral palsy is diagnosed after the age of 1 year. That means we're missing the period of most growth of the brain, because we all know that the baby's brain grows 5 times to reach adulthood, and that maximal period is the first year. So we're missing that period of what we call neuroplasticity, the time when the brain is able to repair itself in response to an injury. Now, why is that important? I think it's important because people like me were taught that you couldn't diagnose cerebral palsy before 2 years of age. And we were taught that there was a historical silent period for cerebral palsy, which the brain would have, there'd be damage, and then there would be a very quiescent period. So those children were missing early intervention. Does early intervention work for children with cerebral palsy? We haven't had enough research because we've been diagnosing it late. Now, some pediatricians will say, look, I've been diagnosing cerebral palsy in babies forever. And that's true. So some neonatologists who meet babies who have severe cerebral palsy, when they've been very sick, they have encephalopathy, they have seizures, then yes, those babies were being diagnosed. But we shouldn't forget that over half children with cerebral palsy are born in a maternity hospital, they go home with their parents, they were completely well, and then the parents spend the first 1 to 2 years saying, there's something different about my child. And they go from doctor to doctor saying, my child's not developing like my other children, is not developing like my sister's child or my neighbor's child. And I think this is very distressing. We have some evidence about early intervention, that it could be helpful. And perhaps the worst, if I take the flip side of this, we know from the data from the Romanian orphanages that children who were there, because they were deprived, they ended up not only with social and emotional problems, which have seemed to have lasted for most of their life, but also the impact on their cognition was quite marked. So they ended up with statistically significant lower IQs. Why do we think that's happening? We know that there are lots of synapses that form in the brain, and the pruning of these synapses starts at birth and goes through to early adulthood. The pruning happens to those connections that aren't used. So you can, a very sort of lay way of putting it, which I think is very helpful, is that it's like highways or roads. So those roads that we use all the time because of the connections, they become our major highways. Those connections that we don't use eventually become country roads that are covered by, grass. And I think that's a really good way to think of the brain. We have some animal data that would suggest that early intervention can be helpful. There's a study by Friel et al. Where they rendered kittens hemiplegic, and they randomized them to different groups. The kittens that were in the early training group, so the kittens were trained or motivated to climb a horizontal ladder in search of food, I think. And then the other groups were those who just had restraint of the limb that wasn't affected, or those who had delayed training showed no improvement. And I think that's very important. So what we're learning from these animal studies is that early, goal-oriented, intense training can help restore the brain function. And I don't see, if it works in kittens, I don't see why it wouldn't work in humans. What about adult data? So the clinical guidelines for stroke management were released in 2017, and the guidelines state, based on randomized control evidence, that early, intense, goal-directed training within the first few days of the stroke, we know that that will really benefit adults who've had a stroke. And yet children who have cerebral palsy are not getting that intense, goal-directed training early, because we know that half of them won't even be diagnosed before the age of 1 year. But that does not mean that if we don't diagnose early, there isn't hope for those children who are diagnosed later. What will help those children is, again, intense goal-directed training. What do I mean by goal-directed? It means that the child with the family have some goals that they wish to achieve, and they work towards that. So there's been an important paper out with Michelle Jackman and Iona Novak using co-op training, which is cognitive-oriented occupational performance. And they've shown that 2 weeks of this intense therapy, using goals that the child and the family have agreed upon, just 2 weeks, shows a marked improvement. And not only that, it's sustained for 6 months. So I think we're getting some really important evidence that may help children with cerebral palsy. And the other thing is the data from, I always think this is very interesting, those London taxi drivers who of course have to drive through cities. London has very, I wouldn't say, it's an interesting road system. So it's not like Paris where there's a grid, and New York you go and there are all these numbered streets. London taxi drivers have to cope with a very chaotic system. And after 3 to 4 years, when they do MRIs, they've shown that these taxi drivers, their posterior part of their hippocampus, where memory is, has grown. And if you look at this quote from this taxi driver who was being interviewed, David Cohen, and he says, "I never noticed that part of my brain growing." It makes you wonder what happened to the rest of it. And of course, David actually was spot on, because his posterior hippocampus, the memory part, was growing, but his anterior hippocampus was actually, well, not his specifically, but many of the taxi drivers, that actually shrunk. And that shrinking meant it affected their visual memory. So they were losing some cognition. So I think when we see that even adults with intense training, because these taxi drivers were intensely learning how to drive around London, and goal-directed because they wanted to know how to drive around London, they showed changes even as adults. Because of this, and because of the fact that we know that most children with cerebral disability are not getting early intervention. So there's a study from Melbourne by Roberts et al. Showing that unfortunately PREMs, premature babies, who later on need early intervention, only 28% of those with a mild disability get early intervention, and only half of those with a moderate to severe disability get early intervention. And it's more related to your social status. So a family who are well off, come from a higher socioeconomic group, will get early intervention for their children. Because of this, we have changed our clinic in the newborn intensive care unit I work in, and we are trying to see more and more children who've been through the intensive care to try and get early intervention for them. We've also taken on the general movements assessment. So nearly all babies in our unit who've undergone surgery will have the general movements assessment during the stay in the unit, and we've changed the time of the clinic to bring them back at 3 months instead of 4 months so we can assess the fidgety general movements. We think this is a very important development in follow-up of babies, and the families have really received it extremely well. We're also starting an early detection clinic for babies who are at high risk of cerebral palsy or have cerebral palsy, and we'd like to see them from 3 months of age to provide early intervention. And also, one of the exciting things that's come out of Sweden has been a program called CPUP, which in Australia we call Checkup. This is active surveillance for infants with cerebral palsy. What they showed in Sweden was that if you do active surveillance, you can eradicate hip dislocation. If you remember, I said that 30% of children with cerebral palsy will have dislocated hips. They've also shown a real drop in the rate of scoliosis, as you can see from the next slide. But before people think that we're just inventing something new, and when you go anything in medicine or in health, you find that somebody has said it before. I'd like to introduce you to Dame Jean McNamara, who was a very famous pediatrician in Melbourne, and she said in the 1940s and 50s that she would like to see early detection and early intervention. She wanted the parents to be doing goal-directed intervention for the parents. And I think that's a very important message which is finally happening.